Good day, dear friends. Group of Companies Denas is pleased to offer you yet another novelty. Updated and improved device called Denas Vertebra. Denas Vertebra has been familiar to our customers for 4 years, and many of them appreciate the efficiency of our device in treatment of spine and other internal organs diseases. And now we are ready to introduce you a brand new device that is the second generation of Denas Vertebra. Now I would like to talk a little about the advantages of the previous model, as all of them have been saved in the new device. Previously, Denas Vertebra had 4 types of programs. Program A. It was intended to affect the entire region of the spine by the wave method. This method simulates the effect of electromassage, stroking, stretching, tapping, and this program is primarily intended for situations when the patient has diffuse disease of the spine without acute localized pain. Since all people walk upright, we have problems with the spine. Program A is needed as treatment of prevention for almost everyone. Program B is intended for treatment of acute localized pain in one or another area of the spine. In this case, we can select the desired zone by processing by using the selection button: cervical, thoracic, or lumbar spine. Program B is most effective for the treatment of recent acute pain. Program C is positioned as a program that is indicated for the treatment of chronic pain. The pain can be not intense, but durable. It may worry the patient for several days, weeks, or maybe even months. By pressing Select the Zone, we can also select the desired zone, and stimulation device will impact only on it. The next program, Program D. This program is designed for the treatment of pain localized on the spot, when the patient can specify the location of it clearly. We can also select the desired zone stimulation, and the device will automatically stimulate this area for 10 minutes. Moreover, the program D may be used as an influence on segmental area of other internal organs having pathology. In other words, knowing the problem, knowing the diseased organ, we can cure this organ from the back with the program D. The program will automatically continue for 10 minutes. We call this method of operation of the program D the applicator mode. But what is most important? The new model of device has the 5th program, Program E. This new program we are going to use for the first time. It is fully able to realize our dream. Automatic, bio-controlled reaction from the organism. In this case, the unit automatically selects the triggered zone and makes an impact on it by healing frequencies. Well, let's take a little more detail. Program E consists of 3 phases. The first phase has an impact of all the areas of your back by the wave mode with the different frequencies. The same impact we have in Program A. The next phase of the program is the test mode. The test mode was designed specially for this model of Denas Vertebra. I must say that this mode wasn't used in any of the previous models produced by the group of companies Denas. In this mode, the device automatically evaluates the reaction of the skin to the previous stimulation. Not the original condition of the skin, as in previous models, but namely skin reaction to a previous stimulation. This phase lasts for 3 minutes. Automatic measurement of skin condition of the symmetric paravertebral areas produced at a frequency of 10 Hz. The machine automatically calculates the results and chooses the area in which there is the maximum difference between the right and the left side, that is to say, the latent trigger zone. I shall repeat, this process is completely automatic. You don't have to put the electrodes, you do not need to record and evaluate the performance and results obtained. The device will do everything automatically. Moreover, it conducts several measurements, and the device automatically calculated the indicators in these areas, in all multiple measurements. After selecting the trigger zone, the device automatically enters the third phase of the program E, treatment. Treatment of the particular zone of the particular patient. I mean, there is an automatic process of induction on latent trigger zone. This stimulation is going on for 10 minutes. Thus, the total duration of the program E is about 37 minutes. At the end of the program, the device beeps, so the session can be completed. So, when do you need to use the program E? First of all, on the stage of rehabilitation. When programs B, C, and D give us the analgesic effect, but we want to improve the overall effectiveness of the treatment. Imagine that the patient doesn't have any specific pain, and there is no specific complaints. But we don't know which area has caused the problem. What is the reason of these diseases? Where is the pain in the spine localized? That is, where is the program E will help. The device will automatically find the zone and will have a treating impact on it. For example, the patient had pain in the spine. We used the previous programs, B, C, or D, depending on the intensity of pain and the duration of the disease. So, we stopped the pain, but the task of rehabilitation is much wider. We have learned to relieve the pain. We don't want this pain to return in the future. We want to change the course of the disease. We want to influence the mechanism of pain, and that's why we needed rehabilitation. We need to find the zones that are responsible for this problem. Sometimes it happens that the patient has the pain in one area on the spine, but the cause of this pain is in a very different place. How to find it? How to recognize it? The program E helps us do that. When we docked acute or chronic pain, we are continuing impact by the program E. When the until will automatically search for latent trigger zones and will have an impact on them with the purpose of treatment. The second important indication for usage of the program E is prevention. We all know how important it is to prevent the development of the disease or the development of its complications. Prevention applies not only to prevent the developments of spinal pain with innervation, but also the other related problems, such as diseases of the circulatory system, diseases of the digestive system, respiratory system, diseases of the musculoskeletal system. We can say that the prevention of the diseases of the spine leads to the prevention and control of other diseases of the internal organs. How to be prevented? Which area is responsible for the problem? Which area is the weak link? This area is hidden. We had an opportunity to use another device for screening or testing. For screening or testing these latent trigger zones. But it was very time-consuming procedure that the patient was not be able to use without the help of doctors, as it was necessary to write, memorize numbers, analysis of the data, look for the trigger zone manually. Today, Program E lets you do this automatically. The device will find this problem area and it will stimulate it. Prevention, of course, is extremely important. The third and very important indication for the Program E is the effects that we get from the spine massage. It gives us general regulating effect. We often use these words at school and medical presentations when we talk about the merits of dynamic electric neurostimulation. But we do not always understand exactly what is behind these words. What is the meaning of the general regulation? We must remember that our body is an unified whole. Whatever the problem may be, wherever it is localized, your whole body suffers in the end. And therefore, we also need to treat not only this problem, we need to conduct impact. We must treat the whole body. And there is nothing better for this than stimulation of the spine, because the regulation somatic and autonomic centers almost all the internal organs, and all body parts are concentrated there. Such stimulation allows us to regulate the operation of the whole organism. All of this is followed by anti-stress effect and regulation of vascular tone, and regulation of all the internal organs of the body. In other words, this program indicated for absolutely everyone. All the people who lead an active lifestyle and are influenced by environment. Summing up the healing capabilities of the second generation of Denas Vertebra, I must say that the device helps us to solve the problem of acute and chronic pain syndromes, and most importantly, it helps to work on the prevention of worsening of development of acute diseases, the impact on the entire spine as a whole. Program E of Denas Vertebra significantly increased the overall effects of the overall efficiency of dynamic electroneurostimulation. Now, let's take the first session on the new Denas Vertebra in the Program E. Well, as usual, the device must be placed on a flat, hard surface. In our case, it will be a medical couch. Before using the device, electrodes must be treated with a solution of a standard disinfectant, such 3% solution of hydrogen peroxide. It is also necessary to cover the device with a special cloth with holes for the electrodes. Thus, the device is ready for use. Next, we lie the patient on the device. Not every patient can lie down on the device from the sitting position. There may be pain, some discomfort, but by roll forming almost everyone can make it. Place the patient so that the neck is positioned below the electrodes of hair growth on the back of the neck. For patient's convenience, you can put a small roller under his head. Next, we turn on the device, select a program button, select the desired stimulation program. In this case, the program will be E, and select the required power of stimulation. Do not forget to ask the patient about his feelings. We need to get non-irritating, pleasant, and comfortable tiling. When the first phase of the program E begins, the device combine and alternate the frequency, and it will run for 23 minutes. Then automatically starts the second phase of the program testing. In this case, the device will automatically reset the power of stimulation almost to a minimum, and will conduct several measurements of symmetrical paravertebral areas in all parts of the spine. There will be made more of such measurements. The duration of this phase of the program is 3 minutes. The patient should lie quietly on the device and not change the power of stimulation. After the test, the device analyzes the data and parameters and select the area in which the volume of the right and left sides are maximally differ from each other. That is where a latent trigger zone situated. And then it goes into third phase of the program E. By the changing of frequency, the device stimulates the trigger zone for 10 minutes. It is possible that the trigger zone is not detected. It does if the figures are the same in all parts of the spine. In this case, the machine will automatically stop the program. At the end of program, you will hear a beep indicating the completion of the work. The patient now may roll off the device on the couch, and it will take 15 or 20 minutes to lie down and rest. Thus, we held the first session of the program E on the new Denas Vertebra. I want to note that the group of companies Denas have one single purpose: to improve the efficiency of dynamic electroneurostimulatio and consequently increase the overall level of people's health. The next device, Denas Vertebra, meets this goal. The studies we have conducted on the basis of our clinics and our medical department have shown that the inclusion in the formulation of a new program of stimulation significantly increased the overall efficiency of the treatment of patients with spinal cord injuries. And there is no doubt that the new device will be a new chapter in the treatment of such patients. We have clinical guidelines for doctors, defended PhD thesis of the effectiveness of the device in the hospital and at home. There is no doubt that the introduction of a new program of stimulation device, Program E, will significantly increase the effectiveness of the treatment of common human diseases. And, as usual, I wish well-being, health, and success to all the distributors and consumers of Denas.